My daughter is 3. We inject a half unit of Novolog for every 25 grams of carbs for breakfast. Oh my God. I barely have that much in a day, and I probably weigh 4 times as much as her daughter. And then 15, and then, oh my. Her Lantus dose dropped from 5 units to half a unit, which she injects before bed. Her doctor now suggests no Lantus because they say her morning blood sugars are too low, 75 milligram per deciliter. What should I do? Well, first of all, it depends on what meter you're using. You better be using an accurate meter, and if you're not, the whole story changes. But if you have an accurate meter, 75 is what non-diabetics run. Now, taking these huge amounts of insulin for a little kid, I'm sorry, it's not huge amount. She's getting very little, except in the case of the Lantus, which was 5 units, but now down to half a unit. So I would say that you should read my book, and that you should be giving her normal blood sugars, which are readily achievable, because it looks like she's probably making a fair amount of insulin herself, but I'm not sure. But she's getting this huge amount of carbohydrate, and you're never going to control blood sugars with that much carbohydrate. And you want to preserve her honeymoon period, which I assume is maybe still going on. And the Lantus, if given properly, should be taken twice a day. But if you're giving her more insulin than she needs, or a lot of insulin to cover a lot of carbohydrate, the Novolog may be hanging over and lasting overnight. So you have to minimize the amount of Novolog by minimizing the amount of carbohydrate, and then it becomes easier to see how much insulin, how much Lantus you need, and usually they need it twice a day. Next question.